Can you talk about the ways in which you and your colleagues are having to improvise tools and basic medical essentials in the hospital?
I'm a critical care nurse. I'm an ICU nurse. I have experience in the ER as well. And I will tell you some of the most important things that we do as interventionists, right? One of the things is secure an airway. You put an endotracheal tube in to secure an airway. You put them on a ventilator. You use a OG tube to decompress the stomach or to do feedings, right? All of that plastic hardware that I just mentioned, for the most part, it has to be reused. In America, if an endotracheal tube comes out of its packing and it hits the ground, God forbid it hits the ground, it hits the bed, hits the pillow, just on the side, it is no longer used. They will grab another one. Here in Gaza, if it hit the ground, they'll go rinse it off and use it. There's an extreme shortage of medication. A typical patient that's intubated in the United States of America is on at least a sedative and it's some sort of an opioid, something for pain and something for sedation. There's a lack of both of those things. There's an extreme shortage to the point where at points they've considered diluting them in order to use them. There is no morphine. They use ketamine and they use propofol. And those things might be appropriate, but they're not ideal. In terms of wound care, the dressings that's necessary, the medications that's necessary, there's almost none. A diagnostic tool that is standard to every hospital in America. One is an X-ray, one is a CAT scan machine. I'm at 𝐓𝐡𝐞 Hospital right now. If a patient here needs to get a CAT scan, they have to be put to an ambulance and shipped off to go get a CAT scan to come back for a basic study. That is not normal under any circumstances. It wouldn't be acceptable in America. It doesn't make sense that it's acceptable here.